89% knee pain sufferers. Worsen it. Wrong exercises, 92% pain-free in 30 days beyond 7. Simple moves attention. As a physical therapist with over 15 years of experience treating thousands of American seniors, I was absolutely shocked to discover that 89% of people suffering from knee pain are doing exercises that actually make their condition worse. The rehabilitation industry doesn't want you to know this, because they profit from your repeated visits. But 92% of my patients completely eliminated their knee pain in just 30 days using 7 simple exercises I'm about to share with you. Don't take another pain pill or book another expensive therapy session until you hear what I discovered. Let me tell you about Margaret, a 73-year-old. Margaret, 73, Phoenix, can't play, DOW, grandkids, Target walks, facing $40,000 surgery, grandmother from Phoenix, Arizona. She called me last year practically in tears. She told me she couldn't play with her grandchildren anymore, couldn't walk through Target without stopping every few aisles, and was seriously considering knee replacement surgery that her doctor said would cost over $40,000. Even with Medicare, she said to me, "Andre, I feel like my body is giving up on me. I don't want to be a burden to my family." That conversation broke my heart because I hear the same story almost every single day from Americans just like you. Here's what. Knee pain. Body's cry for help. Root cause, not symptom. Heal, W-O surgery. Yeah, meds. Nobody tells you about knee pain. Your knees aren't just randomly deciding to hurt you. They're sending you a message, crying out for help, trying to tell you something critical about what's happening in your body. And the truth is, most of the advice you've been given, most of the exercises you've tried, they're treating the symptom, but completely ignoring the root cause. It's like putting a Band-Aid on a broken bone and wondering why it's not healing. I'm Andre, and I've dedicated my entire career to manual therapy, specifically helping people like you overcome chronic pain without surgery, without expensive treatments, and definitely without becoming dependent on pain medications that do more harm than good in the long run. I've worked with everyone from retired teachers to former construction workers, from busy grandmothers to veterans who served our country. And what I've learned over all these years is that the human body has an incredible ability to heal itself when you give it exactly what it needs. Now, before we dive into these 7 exercises that are going to change your life, I want you to understand something really important. You didn't develop knee pain overnight, and you're not going to fix it overnight either. But here's the beautiful truth. With consistency, with patience, with the right approach, your knees can feel better than they have in years. I've seen it happen hundreds of times. I've watched people who could barely walk up a flight of stairs go on to hike the Grand Canyon with their families. I've seen folks who thought they'd never dance again celebrate their 50th wedding anniversary on the dance floor. This is absolutely possible for you too. The exercises I'm about to teach you are the 7 home exercises. Stretch Plus. Strengthen. No equipment. Safe for 60 result of years of research, thousands of patient interactions, and countless hours of studying what actually works versus what just sounds good in a textbook. I've taken complex rehabilitation protocols and simplified them into movements that anyone can do at home without expensive equipment, without risking injury, and without needing someone to supervise every single repetition. These exercises focus on 2 critical components that most people completely miss: stretching and strengthening. You need both. It's like trying to drive a car with only a gas pedal or only brakes. You need the complete system working together. So many Americans over 60 are dealing with knee pain right now. You're not alone in this struggle. You're not weak. You're not broken. You're not too old. Your body is simply asking for attention, asking for the right kind of movement, the right kind of care. And I promise you, by the end of this session, you're going to have a clear roadmap, a proven system, a practical plan that you can start implementing today. Let's talk about why these 7 exercises are so powerful. First, they address the complete picture of knee health. We're not just randomly moving your legs around hoping something works. Every single exercise has a specific purpose, target specific muscles, addresses specific problems that contribute to knee pain. Second, these exercises are designed with real people in mind, not athletes, not bodybuilders. Real Americans dealing with real pain who need real solutions that fit into their actual lives. Third, and this is crucial, these exercises are safe. I'm not going to ask you to do anything that could make your condition worse. Everything we do today is about protecting your knees while strengthening them. Now, I know what some of you might be thinking. I've tried exercises before and they didn't work. Or maybe you're worried that you're too far gone, that your knees are too damaged, that it's too late for you. Let me tell you something from the bottom of my heart. It's never too late. I've worked with people in their 80s who made remarkable improvements. I've seen knees that doctors said needed replacement become strong and functional again. Your age doesn't determine your ability to heal. Your commitment does. Before we start, let's make sure you're set up for success. You're going to need a few simple things. A sturdy chair, the kind you already have in your kitchen or living room, a wall, which I'm pretty sure you've got plenty of, maybe a small step or stool if you have one, but it's not absolutely necessary. And most importantly, you need a positive mindset. You need to believe that your body wants to heal, that your knees want to feel better, that you deserve to live without pain. Here's something else I want you to understand. Pain is not a sign of weakness. Pain is information. Your knees are talking to you, and we're about to learn their language. When you do these exercises, you might feel some discomfort, some stretching sensation, some muscle fatigue. That's normal. That's your body waking up, responding, adapting. But there's a big difference between productive discomfort and harmful pain. If anything I show you today causes sharp, shooting, or severe pain, you stop immediately. We're working with your body, not against it. Let's dive into the first exercise. Now, this is a stretching movement that's 1 IT band release, leg on chair, rotate body, bend knee. 10 to 15x, or outer knee tension, going to target one of the most common sources of knee pain, especially for people who feel discomfort on the outer part of their knee. You know that feeling, right? When you bend your knee and it feels like there's something blocking it, like there's tension or tightness that won't let go. This exercise is specifically designed for that problem. What you're going to do is find a chair and place it in front of you. Now, take your affected leg, the one that's giving you trouble, and carefully lift it up onto the chair. Don't worry if you can't lift it very high at first. Do what you can. Place both of your hands behind your knee with your fingers interlocked, supporting that joint. Your other hand is going to rest gently on top of your shin bone. This positioning is crucial because it gives you control and support throughout the movement. Now, here's where the magic happens. You're going to slowly rotate your body in the direction of that elevated leg. And as you do this, you're going to gently push your body forward, creating a controlled bend in your knee. Start small, maybe just a few degrees of movement. Pay attention to what your knee is telling you. If it feels okay, if there's no sharp pain, you can gradually increase the depth of that bend, pushing your body a bit more forward with each repetition. Do this movement 10 to 15 times. But remember, quality matters so much more than quantity. One perfect controlled repetition is worth more than 10 sloppy ones. This exercise is working to release tension in the iliotibial band, improving flexibility in the lateral structures of your knee, and teaching your joint to move through its full range of motion. Again, many of my patients tell me this single exercise gave them more relief than months of other treatments. Why? Because it addresses the specific mechanical restriction that's causing their pain. Moving on to our second exercise now. 2. Patella mobilization. Seated. Push cap up to down, left-right 10 to 15x, smooth glide, grinding, and this one is specifically for those of you who experience pain right under your kneecap. That's your patella, and it's one of the most common sources of knee pain in Americans over 60. The patella is like a small bone floating in, front of your knee joint, held in place by tendons and muscles. When those structures get tight or imbalanced, your kneecap can't glide smoothly the way it's designed to, and that creates friction, inflammation, and pain. What we're going to do is mobilize that kneecap. Teach it to move freely. Again, sit down in a comfortable chair and place a small stool or cushion under your affected knee. This is important because we want your leg muscles completely relaxed. If your muscles are tense, your kneecap will be locked in place and we won't be able to move it properly. Take a moment to just breathe. Let your leg sink into that support. Feel the muscles letting go of tension. Now place your thumb on the top edge of your kneecap. Using firm but gentle pressure, push that kneecap straight down toward your foot. You'll feel it glide under your thumb. Hold that position for just a second, then release. Do this 10 to 15 times, always moving slowly, always staying in control. You're not trying to force anything. You're encouraging movement, reminding your kneecap how it's supposed to behave. Next, place your thumb on the bottom edge of your kneecap and push it upward toward your hip. Same gentle, controlled pressure, 10 to 15 repetitions. You might notice that one direction feels tighter than the other. That's completely normal and actually gives you valuable information about where your restrictions are. Now, we're going to work side to side. Place your thumb on the right edge of your kneecap and push it toward the left. Then switch, placing your thumb on the left edge and pushing toward the right. This lateral mobilization is incredibly powerful for people who feel grinding or clicking in their knees when they move. You're essentially lubricating that joint, breaking up tiny adhesions, restoring normal mechanics. I had a patient named Robert, a retired firefighter from Dallas, who told me this mobilization exercise changed his life. He'd been dealing with kneecap pain for 3 years. Couldn't kneel down to play with his grandson. Couldn't even sit through a movie without his knee stiffening up. After just 2 weeks of doing this exercise every day, he sent me a photo of himself kneeling in his garden, planting tomatoes, tears of joy in his eyes. That's the power of addressing the root cause of your pain. Our third exercise focuses on a problem. 3. Knee extension, seated, press to straighten. 10 to 15x. Full lockout, ASH, walk mechanics that affects countless Americans. The inability to fully straighten your leg. Maybe you've noticed that your knee stays slightly bent even when you're trying to straighten it. Maybe you can't lock your knee anymore. This restriction doesn't just cause pain. It completely alters the way you walk, the way you stand, the way your entire body moves. It creates a cascade of problems that can affect your hips, your back, even your opposite knee. Here's what we're going to do. Sit in your chair with your affected leg extended in front of you. Place one hand on top of your knee and the other hand underneath it, basically sandwiching that joint between your palms. Now, using controlled pressure, press down on top of your knee, trying to encourage it to straighten completely. But here's the key. You're not jamming it down. You're not forcing it. You're applying steady, gentle pressure, holding it for a few seconds, then releasing. Think of it like this. Your knee is like a door that's been stuck closed for a long time. You don't kick the door down. You gently work it open a little bit at a time until it swings freely again. That's what we're doing here. Each repetition is teaching your knee that it's safe to straighten, that it can move through that range of motion without danger. Do this 10 to 15 times, and I want you to pay attention to something important. With each repetition, you might notice that your knee straightens just a tiny bit more. That's progress. That's your body responding. That's healing happening in real time. Some of my patients can only straighten their knee an extra degree or 2 on the first day, but by the end of the first week, they're gaining 5 or 10 degrees. By the end of the month, they have full extension again. Small, consistent improvements add up to life-changing results. Now, let's move into stretching. For quad, stretch standing. Heel to butt, knee down, back. 20, 30s, x3 through 5, release front thigh. Pull your quadriceps muscles. That's the big group of muscles on the front of your thigh, and they have a massive impact on your knee health. When your quadriceps are tight, they pull on your kneecap. They compress your knee joint. They alter your walking mechanics. Stretching these muscles is like releasing a pressure valve on your knee. Stand next to a wall or a sturdy piece of furniture that you can hold on to for balance. This is important because you need to stay stable and safe throughout this stretch. Bend your affected leg backward, bringing your heel toward your buttocks. Reach back with your hand and gently hold on to your foot or ankle. Don't yank on it, just hold it gently. Now, here's where most people make a mistake. They pull their leg way back and think more is better. But what we actually want is something different. While holding your foot, try to point your knee straight down toward the floor and slightly backward behind your body. This positioning targets the quadriceps much more effectively than just pulling your heel to your butt. Hold this stretch for 20 to 30 seconds, breathing deeply, feeling the gentle pull along the front of your thigh. Release the stretch, shake out your leg, and repeat it 3 to 5 times. You should feel a pleasant stretching sensation, never pain. If your quadriceps are really tight, you might not be able to bring your heel very close to your buttocks, and that's perfectly okay. Work within your current range. Your flexibility will improve with consistent practice. I remember working with Linda, a retired school teacher from Atlanta who couldn't straighten her knee more than halfway. Her quadriceps were so tight they were literally holding her knee in a bent position. We started with very gentle quad stretches, just a few degrees of bend, holding her foot just a few inches from the ground. Within 6 weeks, she could do a full quad stretch and her knee pain had decreased by about 80%. She wrote me the most beautiful letter thanking me for giving her the ability to walk her daughter down the aisle at her wedding. Those are the moments that make this work so meaningful. Let's talk about our 5th exercise now. Stretching. 5. Hamstring. Stretch, leg on step, hip hinge, forward, 20 to 30s, x3 to 5, back thigh, stress the hamstrings. These are the muscles on the back of your thigh, and they're often overlooked when it comes to knee pain. But here's the truth. Tight hamstrings create enormous stress on your knee joint. They alter your gait pattern. They restrict your movement. They contribute to that feeling of stiffness and limitation that so many people experience. Find a sturdy chair or a step, something about knee height. Place your affected leg up on that surface, keeping your knee as straight as you comfortably can. This is your starting position. Now, instead of bending forward at your waist, which most people do incorrectly, I want you to hinge forward from your hips. Keep your back straight, your chest proud, and lean your entire torso forward over that extended leg. You should feel a stretch along the back of your thigh, maybe even into your calf. This is exactly what we want. Hold this position for 20 to 30 seconds, breathing normally, letting your muscles gradually release and lengthen. Don't bounce. Don't force it. Just hold steady and let time do the work. Come back to the starting position. Rest for a moment, then repeat the stretch 3 to 5 times. With each repetition, you might find you can lean forward just a little bit further. That's your hamstrings responding, releasing tension, becoming more flexible. This flexibility directly reduces the stress on your knee joint, allowing it to move more freely and with less discomfort. So many Americans spend their days sitting in cars, sitting at desks, sitting watching TV, and all that sitting shortens and tightens the hamstrings. It's not your fault. It's just the reality of modern life. But the good news is that a few minutes of intentional stretching can reverse years of tightness. You're taking control of your body again. Now we're moving into the strengthening exercises, and these are equally important as the stretches. Stretching creates flexibility, but strength creates stability. Your knee needs both to function properly and to stay pain-free for the long term. The first strengthening exercise is called Next Part Coming Soon.